High demand for COVID-19 vaccines. It is rare that somebody misses a scheduled appointment, but yes, it does happen, leaving extra doses at the end of the day. Good evening. Thanks for joining us for your 5 News at 10. I'm Darren Bobb.
And I'm Erica Thomas. It's leaving pharmacies and doctors to now call people on their leftover vaccine waiting list. 5 News reporter Allie Lynch joins us live. And Allie, the Arkansas Department of Health says in the coming weeks, it's hoping it won't be as tough to get a scheduled appointment.
Yeah, Darren, Erica, Dr. Dillahay with the ADH says the state is still on target to open up Phase 1C by the beginning of April. Dr. Dillahay anticipates that there will be plenty of vaccines distributed across the state in the coming weeks for anyone who wants a shot.
We do encourage everyone to have patience because we know that the production of the vaccines is going to ramp up in the next few weeks.
Right now, leftover vaccine waiting lists are giving those hope who are waiting for their turn to become eligible. Dr. Marty Sharkey, the Fayetteville City Health Director, says getting shots into arms is better than letting the vaccine go to waste.
At the end of the day, the more people we have vaccinated, the better. While we prefer to do it based on the priority groups and those most at risk, the most important thing is getting us to herd immunity and getting everybody vaccinated.
According to the CDC, after a vial is opened or punctured, there are approximately 6 hours before the dose has to be discarded. Dr. Sharkey says you're more likely to get a call if you're on a Moderna vaccine leftover waiting list.
There's 10 doses in that vial. So once that vial is punctured, if they take out 1 dose, they got to use up the next 9 in the next 6 hours, whereas the Pfizer and Johnson & Johnson have fewer doses.
With spring break around the corner, many Arkansans may plan to travel out of state. Dr. Sharkey says she advises against that, especially states that have lifted restrictions.
There's states lifting a lot of their mandates, and these tend to be some of the states that people like to go to for spring break, mainly being Texas and Florida.
The Fayetteville City Health Director believes the COVID-19 variants are worrisome.
We are seeing what's happening in Europe, and that if we continue to let this virus spread and do things that don't try to limit its spread, that we're going to see more variants appearing here in Northwest Arkansas.
Medical experts agree continuing to wear masks and social distance will avoid moving backwards in the spread of COVID-19.
We've got to keep it up. We're really close to the end of this, and I'm just worried that with spring break, that in a few more weeks, we're going to see a surge in cases as a result of everybody traveling.
Covering news where you live, Allie Lynch, 5 News.
All right, Allie, thanks. The CDC recommends getting tested 3 to 5 days after your trip and self-quarantining for a full week after travel, even if you test negative for the virus.